Joining us here, we are so excited to have Dr. Amy Beth Kressel. Always a favorite. Great to see you, Dr. Kressel.
Thank you. Thank you for the opportunity.
All right, so we spoke about this a few weeks back, that there was the possibility of a fourth coronavirus wave, and the CDC just issued very strong words, a dire warning that we should be aware of and really seriously consider. So what are your thoughts about this, and why such strong words?
Well, I think the CDC is frustrated that we feel we're so close to victory, but we are in a race against the virus. The virus is mutating, and there are more variants out there that could potentially escape vaccines. So the more the virus can spread before people can get vaccinated, the more opportunities it has to improve itself. The virus is an RNA virus. It's constantly evolving, trying to find different versions of itself that can infect people more efficiently. I think what's going on in Michigan and other places is really a warning sign. So I will not pretend I know all the reasons that COVID-19 is surging in Michigan right now. But one thing I find very interesting and concerning is that 90% of their cases are the UK variant. So we know the UK variant is more infectious. People who get it tend to have more virus, so they have more virus to potentially spread to other people. And people who get the UK variant tend to be sicker. So my feeling is that's a large part of what's going on in Michigan. And there's no reason to think we in Indiana or any place else are immune to that. And I think Mary, I mentioned on a previous show with you or previous interview, what happened in the Brazilian city of Manaus, which is in the Amazon. It's a major city that's in the Amazon. They had a wave of COVID-19 early on in 2020. Everybody thought that so many people had antibodies that they were safe, but they were not safe from the Brazilian variant. And now people in Brazil are dying at much younger ages. So they have 30-year-olds dying, presumably because of the Brazilian variant. So I'm still so happy about vaccines. And I feel like everybody who wants to get vaccinated in this country will have a chance maybe by July. By July, we're all hoping we'll have enough vaccine for all adults and maybe even children. I mean, Pfizer released really promising results just this morning. And I feel like people are just getting tired and they're sitting down before the actual finish line, and we just can't do that.
So are you thinking that it's vaccination, of course, is where we really want to go. I think, at least is what I'm hearing, and among other doctors that I've spoken to, it's about the vaccination. It's very unlikely we'll reach herd immunity without that, having people naturally infected and having the antibodies. So is it that we think that people maybe aren't being as active in terms of getting vaccinated? Is it the slower rollout, considering different states have different ways of rolling these things out?
Well, I think it's a combination of things. I mean, we have been limited by having vaccine available. So there's certainly plenty of people who have wanted to get vaccine who have not been able to get it. Now we feel like vaccine supplies are going to be more readily available. The reason states are saying anybody who wants a vaccine can get it now, or some states, including Indiana, are saying that, is that the federal government has signaled that we will have enough vaccine. So we should just go ahead and give it to people. There was a staged approach in Indiana as well to try to vaccinate the people at highest risk of dying sooner. My understanding is approximately half of all people age 65 and over in Indiana have been vaccinated. So that's a good thing for everybody. But that still leaves plenty of people who can get COVID-19 who are not protected. So variants could spread. They can make potentially younger people sicker, depending on which variant it is. And there are numerous ones out there, each of which does something slightly different. So it's a combination of things. I also think people are starting to warm up to vaccines. So I just saw data that vaccine hesitancy is decreasing, at least in some populations. And that's a good thing for everybody. I think the message, though, is if you're still on the fence and waiting it out, be aware that the situation is changing rapidly. and that more dangerous forms of COVID-19 are emerging. So you really shouldn't wait. Um, we signed up a family member today on Zotec on the ourshot.in.gov. We just signed up my son, who's newly eligible. So it's out there, and we can just, again, I don't know how many times I can say it, just get vaccinated.
It becomes sort of just, I think, right, people are hearing this, but it hasn't quite gotten through just yet for some people. And I don't know. And as you said, we talk about these variants, and we understand now that they are more transmissible, and people at younger ages are dying, which doesn't have to happen. And also, I remember us talking about, we're really not certain about if some of these vaccines can work against these different types of variants. So what does how does that play into vaccination?
Right. So first of all, the vaccine will never make it worse. The vaccine works against the original virus, and all three vaccines work very well against the UK variant. So that's really good news for people in the United States, where the variant that seems to be taking off is the UK variant. That said, the South African and the Brazilian variants are present, not so far in Indiana that we know about, but present in Florida, where people are taking spring break. So, the viruses are going to be fighting each other, and we don't really know who's going to emerge the winner. We could still have a surge of the South African and Brazilian variants. We just don't know. And there are other variants lurking out there. There's one in California, there's one in Tanzania. So we're going to have to be really aware of this. The good news is, again, the Johnson & Johnson vaccine, which was actually tested in Brazil and South Africa. When these variants were there, it was really very protective. And nobody who got that vaccine, even in those countries, none of those people, 28 days after vaccination, none of them died or were hospitalized. So that's really good news. It's not as clear, the story with the Pfizer-BioNTech or the Moderna vaccines. People are trying to figure it out by looking at antibodies from people who got vaccine and testing them against artificial viruses that are made to look like these strains. That data is a lot less clear. I'm hopeful that the vaccines will still be able to protect against hospitalization and death, but there could be reduced efficacy. And then these other new variants that are emerging are big unknowns. The virus is just basically creating beta versions of itself all the time, trying to exploit weaknesses in our defenses. So the sooner people can get vaccinated and prevent virus from hopping from person to person, the better off we're going to be in the long term. The more opportunities the virus has to pass person to person, the more opportunities variants can have to emerge. So vaccine is important. And Mary, I do want to remind people that there's no reason not to continue wearing a mask. I understand that Governor Holcomb has said that April 6th, masks will be optional in Indiana, but they're really important still because, again, not everybody's vaccinated. People who are vaccinated could possibly be carriers. The data looks promising for the Pfizer-BioNTech and Moderna vaccines, that they're really good against protecting against carriers. But here's the big thing. We only really have that data for the UK variant and the original strain. I don't think we have any kind of good sense about how well vaccines protect against being an unwitting carrier against the variants. So I personally intend to still wear my masks in public. And in Indianapolis, of course, the largest city, we will be continuing that. But even if you don't have to wear a mask, there's really no downside to wearing it until we're through this.
Dr. Kressel, I'm with you. I'm signed up for my vaccine, my first Pfizer shot in a couple weeks, got right on there. And I will continue to wear my mask until this data comes out. And it's fine. People have freedom. I think, there's these restrictions or whatever, these certain mandates are frustrating and people want to have freedom. But I don't know, just for me, as you said, I will continue to wear my mask. I will continue to socially distance respectfully, and with other people who may not decide to do that. But we just don't know enough. And out of precaution, I think that as someone who is so well versed and so well known, this is such an important message. And if we can just hang on a little bit longer, we can prevent, at least this is just my opinion, we can prevent this if we keep doing this, which leads me to my next question. Some are feeling that masking is over and socially distancing is over once they get the shot. I mentioned, you said something really interesting. It's not the shot of freedom, but the freedom of fear shot, which I thought was so well put. And then also recommendations of what people can and cannot do. So going off of what we were just talking about, what else can we say to these individuals that it's not freedom just yet?
Right, and I'll add to that. I've also heard people say, well, if I still have to behave the same way after my vaccine, why should I even bother? So you're protecting yourself, obviously, right? That's why you should bother. You're not going to have to worry about yourself being sick and hospitalized. But yes, so I think the CDC is taking slow steps. They're being very cautious. They're really worried that we're so close to victory and we're going to lose it. But they're saying you can meet with other people who are vaccinated and take your mask off. They do recommend only small gatherings and a limited number of households. I think they're saying 3 households, including your own. So maybe 3 different groups of people. If you're all vaccinated, you could be together and take your masks off if you choose. And then they say that you can also, if there are people among you within those households who are not vaccinated, you could also take your mask off, provided that those unvaccinated people are not high risk. I think that guidance is a little bit tricky because people need to remember a lot of things do increase risk of severe COVID, including simply being overweight or even underweight, actually. So common in our society. So they're still saying don't travel if you don't have to, and certainly no large gatherings without wearing masks.
And well, you mentioned obesity, and I think sometimes people might not even realize that. I mean, BMI is the marker for obesity,
Right.
And don't even realize that they might be overweight or obese, which is something really interesting that you bring up. I'd never considered that. I mean, I knew that was a risk factor. However, not being aware could be something potentially very risky. And I mean, how is Indiana doing? I know last time we talked, it was plateauing, maybe slightly going down, but not at the rate in which we wanted it to. So where are we now?
So we're considered moderate incidence according to CDC's definitions. However, cases are slowly increasing now. So they're not decreasing, they're not plateauing anymore. There's a slight uptick. So we need to watch it carefully, and it's just a reminder to us, like, this is not over.
I know there's just no other way to say it. This isn't over just yet. Any other thoughts about this topic? I mean, what we're talking about right now. I mean, what is your message?
I know, I feel like I've been saying this for months now.
Say it again. Say it more. We need it from you, really.
All I can say is I'm tired also. But I've also seen people die of COVID-19. So I am highly motivated to stay the course, and trying very hard not to give up just yet. I have people I care about who I'm trying to keep safe. Even children can get complications of COVID-19, even though we think of this as more an illness of adults. So I'm trying to keep my family safe. I will continue get my family vaccinated whenever my family members are eligible. And I will continue to, as hard as it is to resist traveling this spring, I'll stay close to home. I'm going to be doing day trips to outdoor places, but no adventurous travel, quite unlike what I would have done if this were not a pandemic. Um, and trying to remember, I'm still going to wear my mask in public, at least, you know, indoor public spaces. Trying to keep my family safe, and just holding on, and really, again, I feel the fatigue personally, but this is not over, and we have a lot to lose if we don't get it right.
Dr. Kressel, always great to talk to you. Such great advice, expertise, and insight. Really, thank you so much.
Thank you so much for the opportunity.